Hello, everyone. Welcome to Nova Southeastern University's South Florida Geriatric Work Enhancement Program podcast, also known as the SF-GWEP podcast. We are here to educate, encourage, enhance, and promote all those amazing health professions working with the elderly, including patients, caregivers, and support systems. I'm Dr. Sweta Tewary, Assistant Professor in the Department of Geriatrics, Kiran C. Patel College of Osteopathic Medicine at Nova Southeastern University. I am also the Administrative Director of the HRSA-funded South Florida Geriatric Workforce Grant. Today's podcast is part of the GWEP's initiative to better understand the use of non-prescription medications among older adults. It is my honor to present a friend and colleague, Dr. Andrea Levin, an Assistant Professor of Pharmacy Practice at Nova Southeastern University College of Pharmacy, with a practice specialty in board certification in ambulatory care. Currently, Dr. Levin assists in the care of adults with chronic disease states where she takes students on rotation and teaches in the Integrated Disease Management and Integrated Pharmacy Application courses in the College of Pharmacy. Dr. Levin also serves as the faculty of the AIDS Education Training Centers Grant and Geriatrics Workforce Grant, where she focuses on providing continuing education to healthcare providers. So Dr. Levin, welcome.
Thank you, Dr. Tewary. It's a pleasure to be here.
So Dr. Levin, to start with, can you discuss or just kind of inform us about the prevalence of the over-the-counter medication or the non-prescription medication use in the elderly?
Sure, and it's very hard to quantify, and unfortunately the data, it doesn't come out as often as we would like it, but a few years back we found that while older adults, so individuals who are 65 years and older, comprise roughly about 13% of the U.S. population, they actually account for about 30% of over-the-counter medication use, which doesn't seem as though it's a lot. You may think, well, there's another 70%, but when you think about the percentage of the population, it actually is quite high. And then if we think about, well, what about other medications that an individual may be taking, roughly about 25% of older adults may be on a combination of 10 or more medications, and that would be over-the-counter and prescription medications. So it's actually quite a high prevalence.
Wow, that's interesting. So why do elderly especially have a high level of confidence in the natural products?
I think a lot of it has to do with just the fact that it's not prescription, it's a non-prescription product. So you can just go to your local pharmacy, get it off the shelf, you don't need a prescription. And a lot of times, we think about over-the-counter medications, but we also should be thinking about dietary supplements, alternative medicines. There are so many other agents that comprise that. Over-the-counter, it has to do a lot with package labeling, but there are also different food additives, dietary supplements, and alternative medicines that are also, their use is also on the rise. So there's a lot of confidence in that I can choose that medication. Mm-hmm. It's on the shelf. I can take it myself. And a lot of times individuals are not even reporting those medications to their healthcare provider, so that can be tricky. Mm-hmm. So I think that's a big part of it, is just that, patient empowerment to be able to choose the medication for yourself, and that thought that if I can choose it for myself, then it must be safe. And then also there's also a placebo effect that can occur. So that means that, you take a certain alternative medicine, you may feel better even if it's not necessarily working as much for you, because you have that empowerment of being able to take it. Also, I find that in different cultures and different societies, individuals talk very much about their medications, and if a certain over-the-counter product or non-prescription therapy is working for your friend, down the street, you may want to try it as well. So I think it's just a lot of, you can choose the medication yourself, and that perception that there really are no drug interactions.
And that's really useful information, especially when we go and buy vitamins over the counter. Are there any potential side effects that we should be aware about, and also about the drug disease interactions or drug to drug interaction that in general patients they do not know much about?
No, absolutely. And that's really, as a pharmacist, that's where I really am concerned about for my patients, because they don't realize, again, that there might be some drug interactions, not only with having so many over-the-counter products that they're currently using together, but also with their prescription products as well. So when looking at the amount of over-the-counter medications that are used, we tend to see the most frequently used are your ibuprofen, your aspirin, acetaminophen, and diphenhydramine. So those tend to be the most utilized over-the-counter products. And when we think about ibuprofen, which is a non-steroidal anti-inflammatory drug, again, you may think, oh, I have a headache, let me just grab that medication and take it. But then also if you have high blood pressure, for example, ibuprofen can cause you, and also medications like ibuprofen, like naproxen, they can cause you to retain or to hold on to water, and that can cause your blood pressure to increase. Also, if your kidneys are not working the way that they should be, it can also affect your kidneys as well. So there are just so many other things that we don't think about. Also, if you're on a medication like aspirin and you take something like ibuprofen or naproxen, that can increase your risk of bleeding. And also, even by themselves, for individuals who are not older adults, long-term use of non-steroidal anti-inflammatory drugs can also increase your risk of having an ulcer and what we call a GI bleed or a gastrointestinal bleed. So those are all just things that we want to be aware of. Mm-hmm. As far as acetaminophen, there are definitely concerns as far as liver. So we have some individuals, if we think about, acetaminophen, it's found in about 600 products. So it's everywhere. So if you have an individual who's taking acetaminophen in one product, they might be taking it in another one as well, and it's very easy to overdose on acetaminophen. So that could increase your risk of going to the emergency room with issues with your liver. Looking at diphenhydramine, sometimes in your PM products, so products that are taken at nighttime, that could be an issue because it has what we call anticholinergic effects, meaning that it will dry you out. So you can get dizzy, it can increase the risk of falls. So we try to avoid that medication, but if you're having trouble sleeping, a lot of our patients, whether they're older adults or younger adults, may go to some of those PM products, and that can increase their risk of falls. So I've had patients, for example, who are taking certain PM products, plus taking diphenhydramine to try and help them go to sleep. So not only should they not be taking diphenhydramine, but now they're actually taking above the amount that they should be. And I've had patients who have had hip fractures and who have ended up in the hospital because not only should they not be taking it, but now they're taking actually more. So it's very important to consider those concerns. Also aspirin. I remember when I was in pharmacy school, it seems like 100 years ago, we were recommending aspirin for everybody. Once you hit 40, you should be on aspirin. But now that's not the case. Really what we call for primary prevention, meaning to prevent the first occurrence of, for example, a heart attack or a stroke, there's really not a lot of data that supports aspirin use. However, aspirin is a great medication for individuals who have already had an event. So what we call secondary prevention. So you're trying to prevent a second heart attack or a second stroke in certain situations. Again, it depends on the stroke. But we have a lot of patients who might be on aspirin when they don't need to be. So it's very important to consult their healthcare providers to see, should I be taking this? Because in some individuals, the increased risk of bleeding is not worth the perception of benefit that they may receive. And also there are certain classes of medications, for example, PPIs, so proton pump inhibitors. Mm-hmm. So we have like omeprazole, for example. I'm just pulling that one out of my hat, so to speak. Mm-hmm. Those medications also are over the counter. They used to be prescription only, and so sometimes a patient may have, or an individual may have, just some reflux, some heartburn. They take these agents. If you take them for a long period of time, it can actually increase your risk of fracture. It can also increase your risk of having this infectious diarrhea called C. diff. It can affect your magnesium levels. And again, these are all things that we don't necessarily think about. Mm-hmm. We don't think about all of the side effects that can occur with over-the-counter products. So it is important that, consulting your healthcare provider, your physician assistant, nurse, pharmacist, we all need to be in the loop because, again, we need to see what are you taking, your prescription medications, all of your over-the-counter medications, any natural supplements that you might be taking, because there could be these underlying drug interactions that could potentially increase your risk of bleeding, increase your risk of falls, and just increase the risk of death. So that's very important for us to be mindful of. And also even thinking of, some of our nasal decongestants, like pseudoephedrine, for example, for individuals who have high blood pressure. Taking a decongestant like that can actually worsen your blood pressure. So again, certain things that we don't necessarily think about because it is accessible to us on the shelf, it is important that we are always mindful of that.
One question that I wanted to ask is that, whenever patients present themselves, especially older adults, to the providers, and when they're asked about the medication list, they would like to avoid the over-the-counter. How should clinicians address this issue?
So one thing that I always tell my students, you never want to say, what medications are you currently taking? You have to expand it because medications, automatically the majority of individuals will think, okay, prescription medications, and that's what I'm going to report. Mm-hmm. But you always want to say, what prescription medications, what over-the-counter products, and what type of supplements. You always want to, I call it the trifecta of, a medication reconciliation to really get an idea of what an individual is taking. And sometimes they may want to get through the visit and they're like, oh, no, I'm not taking anything. So sometimes we'll follow up and say, oh, what do you do if you have a headache? What do you take if you have a headache? And then that kind of, it's like, oh, by the way, yeah, if I have a headache, I take ibuprofen or I take Tylenol, or actually I take this, other product. So I think that is also helpful to expand it, to not be so specific with the words that are used, also using open-ended questions. I also advise my students, and when I'm talking to patients, I always say, try to avoid those, where you're leading the patient. So sometimes you'll say, oh, you don't take any over-the-counter medications, right? Because, if you say that, then the patient's going to say, oh, no, of course not. Mm-hmm. Because you're almost like leading the patient. It's like, oh, you don't do that. Or you'll shake your head no as you ask a question. So it's important to, how are we approaching a patient? Are we asking those open-ended questions? Because if it's open-ended, the patient will respond, even if they say, oh, I don't take anything. But if you say, oh, you don't take any over-the-counter or supplements, correct? And the patient will either have to say yes or no. Mm-hmm. And in the way that you ask it, if it puts a negative tone on it, that could potentially affect the individual's response. So very open-ended, non-judgmental, and just again expanding it out to those prescription over-the-counter and supplements. You can ask about vitamins, just ask more targeted questions, but really start with some of those open-ended questions. I find to be helpful.
That's good to know. So it's really asking the right questions.
It is, and also having an individual bring in everything. I always say that, if it's a supplement or anything, put it in a bag, bring it to the office, and, whether it's over-the-counter, just anything that you consume, of course not food, but if any of the medications that you consume, prescription over-the-counter, herbal supplements, anything like that, put it in a bag and bring it in. And then that way, because there are so many different products that are out there, that way we can see what the ingredients are. Sometimes they're a combination, over-the-counter products or supplements, and that way we can really see what's going on, because there are a lot of databases and a lot of resources that we can use as clinicians to ensure that there are no drug interactions and ensure that there are no just potential side effects for the patient.
So since we know that there's so many over-the-counter products and vitamins and which people use, what are some of the beneficial over-the-counter products that you would be recommending or accepting?
And it's a great question, but it's a very tough question because everyone is so different. I know that I have seen clinicians. I know that there are television shows that say you should always have some XYZ product on you, but it's very hard. Like, there are certain supplements that we should have, but I always encourage using dietary, so using the diet form. So if you need omega-3 fatty acids, having fatty fish like salmon, for example, that is a great source of omega-3 fatty acids. If you feel that your diet is not where it should be, to attempt to change your diet to eat healthier. However, if necessary, having a multivitamin, if you feel that your diet perhaps is not where it should be, but making sure that it's not infused with extra energy or all of these things, because usually if it is infused with something that will boost your energy or do XYZ, there might be something else in there besides the supplements that you need throughout the day. And then ensuring, if you need to take, a non-steroidal anti-inflammatory drug or acetaminophen, just making sure that you talk to your pharmacist, talk to your other healthcare providers, because there are safe options for that. Just making sure that you as an individual, it's safe for you. Also, calcium, for example. We have many of our patients who are postmenopausal, older adults, who would benefit from calcium supplementation. But again, through diet is always going to be better than through a supplement. So ensuring that your diet is rich in calcium-rich foods. There are fruits and vegetables and different products now that are infused with calcium. So that's always my recommendation. However, if we have individuals who have osteoporosis, they do need calcium supplementation. And even though there are concerns with over-the-counter use of calcium, we may need to go that route because you always have to weigh the risks and the benefits of, potential fracture and, some of the concerns that we have with calcium. So again, diet is always best, trying to get those foods. So if you have high triglycerides or somewhat elevated triglycerides, trying to get some of that, triglyceride lowering through diet, through fatty fish like salmon, calcium through calcium-rich foods. But again, some individuals may need to be on fish oil supplementation. They may need to be on calcium supplementation. They may need a multivitamin. And those are all things that are okay. It's just important to have that open dialogue with your healthcare provider.
Speaking of over-the-counter products, Dr. Levin, there are different brands around it. Mm-hmm. And, patients are often confused in terms of which brand should be used. Do you have any recommendations around them?
It's a great question because you walk down the aisles and there are so many different products out there. Some are brand names, some are generics. There's a really big price difference between the brand and the generic. So my gut reaction is always to go with the generic. They are, within a certain percentage of potency or how strong they are compared to the brand. They do go through, the approval process as far as just ensuring that they are appropriate. As far as your over-the-counter medications, any type of natural supplements or dietary supplements do not go through the Food and Drug Administration, but our over-the-counter products do. So I have a lot of faith and a lot of, I feel that our generic products are a really good option and, again, much less expensive. Mm-hmm. So I tend to go that route because, again, it could be double the price or even triple the price. It really does depend because you want to see, how many tablets or how many capsules do you get in the brand versus the generic. So again, I'm always a proponent of generic products, and that's not only for over-the-counter medications, but it's also for prescription medications as well in 99% of situations. But again, it's very important to read the back. So you're always going to have directions, but you're also going to see what the active ingredients are. Because as I had discussed earlier, acetaminophen, for example, is found in approximately 600 products. So you want to make sure that you're not accidentally having acetaminophen from one product and another product, or a decongestant in one product and another product. So that's the main thing, is just turning that box around, looking at the different active ingredients, reaching out to the pharmacist who's most likely there, mm-hmm. and then that would be very beneficial for the individual.
Thank you, Dr. Levin. Thank you so much for joining us today. I'm really grateful to you for an informative discussion, helpful for our providers and patient education. Dr. Levin, it was a pleasure having you.
Thank you so much. It was a pleasure to be here.